Hello and welcome to another session of Dr. Barbara Miller's NCLEX review. For this short video, we'll focus on gastrointestinal tube that all nursing students should get familiarized with those type of tubes in the event that the State Board of Nursing will ask questions on these types of tubes. So let's start with the different types of gastrointestinal tube. For example, your nasogastric tube, okay? Such as the Levin. The Levin is a single lumen tube, and the purpose of the Levin tube is to decompress the stomach, like the ileus, the gastric atony, or the intestinal obstruction. If the patient has an obstruction, these tubes will utilize. So nasogastric tube, you have your Levin, that's a single lumen tube, and you also have your Salem sump tube, that's a double lumen tube. And the purpose for the Salem tube is to obtain specimen for analysis, like your pH of the gastric fluid and the presence of blood. Okay, so the procedure for both nasogastric tube, whether it's a Levin tube or Salem sump tube, you want to elevate the head of the bed. You want to verify the placement. You want to provide frequent mouth care and maintain the patient on an NPO status. Another tube that you should get familiarized with is that of the Miller-Abbott double lumen tube, okay? And the purpose of the Miller-Abbott double lumen tube is for small bowel suction, the bowel, okay? And the procedure for this, you want to reposition the patient every hour or so. Do not tape the tube to the nose. You want to monitor the advancement of the tube, and also you want to assess the color of the gastric content. So Miller-Abbott tube, for aspiration, you want to inflate the balloon on the tip. Then you have the Senstaken Blakemore tube, okay? And this is a triple lumen tube for esophageal balloon rather, or gastric balloon, or suction irrigation. So what's the purpose of the Senstaken Blakemore tube? Is for treatment of esophageal varices. It can cause potential trauma and complication for the client, such as rebleeding, pneumonia, and respiratory obstruction. So the procedure for the insertion of the Senstaken Blakemore tube, you want to monitor the patient for respiratory distress. You want to see if the patient is having any dyspnea, any shortness of breath. Most clients have the endotracheal tube. You want to keep a scissor at the bedside, and you want to monitor for signs of shock. So you want to check the blood pressures. You want to check the pulses. Okay? Thanks for watching this short video on gastrointestinal tube, such as your nasogastric tube, which are the Levin single lumen tube, your Salem sump double lumen tube, your Miller-Abbott That's also a double lumen tube, and your sense taken Blakemore tube, which also known as the triple lumen. Please like, share, subscribe to the channel to help it grow. See you in another video. Thank you so much.